You are listening to the Millionacres podcast. Our mission at Millionacres is to educate and empower investors to make great decisions and achieve real estate investing success. We provide regular content and perspective for everyone from those just starting out to seasoned pros with decades of experience. At Millionacres, we work every day to help you demystify real estate investing and build real wealth. Hello, I'm Deidre Woolard, an editor at Millionacres. Thank you so much for tuning into the Millionacres podcast. So there's no denying that this has been one of the toughest years and the toughest times this country has ever faced. Death toll from COVID-19 has been devastating, especially among the elder population. Right now, hope is on the horizon. We're watching people get vaccinated, but it's still going to be a long road ahead. And so many people are wondering what we can do to help. So today I'm talking with Sharon Wilson-Geno, who is responsible for the overall strategy and operations of Volunteers of America National Services. National Services owns and operates more than 30 senior living and care communities throughout the United States, as well as several hundred affordable senior, multifamily, and special needs housing and other real estate projects. So Sharon, thank you for joining me today. And let's start by explaining what Volunteers of America actually is.
I'm very happy to be here today. Volunteers of America is going to be 125 years old next year. We're one of the oldest and largest social service organizations in the country that was founded with a mission to serve America's most vulnerable people. We serve now in 46 different states in Puerto Rico and the District of Columbia. Our organization is really broken up into two parts. One is we have 30 local affiliates that are based in communities across the country, and each of those local Volunteers of America affiliates serves in a different way. We provide a whole myriad of social services, everything from behavioral health to substance abuse recovery programs to charter schools to foster care and a million other things in between. The other part of the organization, which is the part of the organization for which I'm responsible, is Volunteers of America National Services. And National Services operates coast to coast, but we only do two things. One, we are one of the largest nonprofit affordable housing developers in the country. We have over 17,000 units in 40 states and Puerto Rico. And the second thing we do is senior health care. So we run over 46 senior health care programs in 7 states. And we do everything from 8 different lines of business. So we run skilled nursing, we run assisted living, we run adult day, we run a nursing home without walls program called the Program for All Inclusive Care for the Elderly, or PACE. We run a geriatric psych hospital, and a variety of other smaller programs. So we have through the COVID experience, we've had eyes on a lot of the work that we do on the housing and the senior care side. It's been an interesting time.
Yeah, I'm sure. Let's talk a little bit about that. Certainly, I know that COVID has disproportionately affected the elderly. I know some people who've lost parents and lost grandparents. And I know that this has changed how people view elder care and nursing homes. Do you feel like that's a temporary shift that's going to change after we get a vaccine? Or is there sort of a different feeling that you're noticing?
Yeah, I think that's a really good question. And I think there's been a lot said about, are these good and safe places to be? And I think a lot of facts are missing from that conversation, which are who are the people that are traditionally in senior care facilities? They are our most vulnerable. And we've sadly lost a number of people in various facilities that we have. But many of them were already on hospice care. Many of them have these pre-existing conditions for which this really dreaded virus goes right to. So I think there's some public perception that somehow it was the care facility that didn't do enough. But when you have a collection of people for whom this disease is completely targeted, those numbers are going to be very different from what you're going to see in the general population. So I think there's some skewing of what that is. But more to your question, is that concern going to be temporary? Frankly, I think so. Our senior care facilities are going to be first in line here for the vaccine, as well as our staff. So if people are concerned about their loved ones and they want to be sure they get vaccinated, being in a skilled or other kinds of senior care facility is one place where they can maybe have that opportunity sooner and be surrounded by staff who also have had that opportunity as well. So, but I think as we talk more, I think there's going to be a whole variety of kinds of ways that seniors are served in the future. This is just one of them.
Interesting. So, as far as those vaccine like that rollout, what is that looking like already? Have you been in touch with different providers?
Oh, we have a date to start, at least in some of our facilities,
Awesome.
December 28th, and that was news today. It is, and we've been back and forth with our consulting team today, a clinical team, about how that's going to work. The CDC has really given us a nice protocol of how you prioritize who gets the vaccine and how that works out. There's going to be some timing issues with the different national providers that we're working with, so we have to sort of figure that out. There are concerns with staff about people having side effects from the vaccine, about being out for work for a couple of days because of that. And being sure we are staffed sufficiently and we're staggering how that vaccine rolls out, both to be sure that residents who potentially could have side effects are cared for properly when that happens, and two, to be sure we have sufficient staff to cover those possibilities as well. So it's a very complicated process, but we're excited to get started.
Yeah, I'm sure. So that brings up my next question, which is about healthcare and housing and the ways that they're connected. I know that's a passion point for you, and I think it's interesting this year that the federal eviction moratorium came from the CDC because they were talking about it being, the homelessness has become a health risk. So do you think we're going to see more interventions like that, and specifically around senior care?
It's already happening. The research finally, after years and years of talking about this, is clear. Housing is healthcare, and healthcare is the base, and housing forms the basis for good healthcare as well. And healthcare is housing. So we have a really good basis to work from. It's of all the really awful and difficult things that have happened during this pandemic, I do have to say that spotlight on the growing need for better senior care and housing to help support that senior care in a cost-effective way has been something of a positive side effect from this pandemic.
I would say another positive side effect, if it can be said, is community. So I know the people in your units had to shelter in place for a lot of the year, and that isolation was hard on people. But I think we're also seeing community kind of gather around people. We're seeing food banks and a lot of donations happening. So, what do you think we've learned this year about community in general?
We are all in this together, and our seniors are an important part of our communities. And I think our history of doing senior care has often been to isolate seniors, to have them in specific locations, a little bit out of sight, out of mind. We haven't always integrated the talents and skills that many of our seniors have with our communities as a whole. And to see people step up and realize that those seniors needed help and have helped in so many different ways in our communities across the country, I can't explain to you. And even our own staff, who's chosen careers in senior care, have been asked to do new and different things that they were never asked to do before. We've learned how to play hallway bingo. We've learned how to do yoga classes from a courtyard down below where people stand at their windows. We have learned just to listen. And a lot of that listening has happened one-on-one via telephone calls, via socially distanced ways. So it's really nice to see that people have finally, because they're so vulnerable, have seen the value in supporting our seniors in new and different ways.
Are you seeing a rise in senior homelessness? Is that something that you're also concerned about?
This is a growing tsunami of seniors, as many people know, that the growth in the senior population is enormous. And there's a significant growth between 2010 and 2030, when the baby boom generation all turned 65. We're at 2020 right now. So we are in the middle of that accelerated growth piece. And then there's even more growth on top of that. And what's happening with that, it's not just that there are more seniors by population, but because of medical advances, they are living longer. They are living with more chronic health conditions because we can now treat them, and they're living longer in poverty. Sadly, because many of them had never expected to live as long as they have, and their savings and the actuarial tables on their pensions, to the extent they have them, did not anticipate lives into the 80s or 90s. So poverty and just making the bills are one of the increasing issues that we're going to be facing. There are going to be more and more low-income seniors in our communities who are going to be living with chronic health conditions. And we think sometimes of people, just going into retirement and traveling and spending time. They're not going to have those kinds of luxuries available, because the two things driving their costs are increased medical cost care, and two is housing.
Yeah, I think that's an important point. And I know building affordable senior housing is challenging. Certainly, there's been concerns about funding and financing that are probably changing. There's been a bit of a senior housing glut, I know, from an investor perspective. But what are you and your team exploring as solutions in terms of funding and financing?
There's a whole range. When we talk about senior care, I think people traditionally kind of gravitate toward the nursing home, the assisted living, the senior health care side of it. And you're right, there has been a glut of that kind of investment. I think primarily for optimistic investors who saw the growth in the population and said, yeah, that's exactly where I want to be. But what's changed fundamentally is what seniors want. The baby boom generation is not the generation of World War II, many of whom were serving and are now serving now more baby boom generation. Those people were very focused on security and service. So moving into a senior care type facility where they could get that kind of service and know that they were being taken care of was a really important aspect for them. The baby boom generation, they really want to be relevant, and they really want to be integrated within communities. So what we're doing is we're always going to continue to provide that senior care piece, because there's going to be a percentage of that population that's still going to need that kind of high level of healthcare service. And while people used to come to our nursing homes or assisted livings and live there for 10 years, they're now living there for 10 months. They're staying in their homes much longer, in part due to economics, but in part due to their strong desire to be relevant in the community. So we're providing more and more home and community-based service care. So that's really the shift in the pivot that's going to be, I think, happening in the senior care space over time. And much of that is going to be provided in independent senior housing. And much of that also will be provided, for the reasons I indicated earlier, in independent senior housing that has a subsidy so it can support folks of a lower income bracket.
Interesting. In other countries, I know they've paired like college students with seniors and things like that to try to help seniors not feel like that. Do you feel like seniors really want more integrated communities?
Yeah, they do. And it's been, again, the pandemic has really brought that out, where we've had seniors in some of our buildings who've been very independent, and during the pandemic, they have come down and we're not doing social events in the community rooms. We're not doing that kind of group activity. And it's been interesting to see, even some of the most independent of them, how much they've missed that and how they've really been clamoring to get back into those kinds of events. At Volunteers American National Services, in our independent senior buildings, many of which are for folks of modest means, we don't just provide housing, we provide housing with services. So there are social workers, and in some cases, preventive health nurses, and in some cases, community health workers who work with that population on an ongoing basis to help leverage services that they need in the communities, help facilitate what's going on with them, and navigate the healthcare system. This is really the growth area for our services, where we've modeled a new paradigm called Aging with Options, where we're ensuring we have social workers, community health workers, in some cases a wellness nurse, and technology is part of our independent affordable buildings. So they have access to all these different means and all these different ways to stay both connected with community, but also connected with the healthcare system.
Fantastic. Well, thank you. That's a great place to take a short break. During our break today, we are excited to have Millionacres lead investment analyst Matt Argersinger here to speak briefly about one of our newest services, Real Estate Winners. Thank you for joining us, Matt.
Thanks for having me.
So what is Real Estate Winners and who is it for?
Well, I like to think of Real Estate Winners as our answer to Stock Advisor in the real estate market. It is a service that provides recommendations on publicly traded real estate investment trusts and real estate companies. So it's a pretty big universe out there. There's over 200 REITs to choose from and probably dozens, if not hundreds, of real estate companies that are in our universe. And we provide regular investment recommendations as well as commentary on the market, educational material. And it's really designed to get anyone who's interested in investing and learning about real estate started.
So is it geared toward new investors or is it more for seasoned pros?
I think Real Estate Winners can serve both. I think if you're a new investor, maybe you're just getting started with stocks and you want to learn more about how to add real estate to your portfolio, great place to start. If you're a seasoned investor and just thinking, okay, how can I diversify my portfolio, maybe reduce the volatility in my portfolio, maybe add some income to my portfolio, then I think Real Estate Winners is a great solution for that cohort as well.
Fantastic. What are the benefits of being a member of Real Estate Winners?
Well, I think the number one benefit is from day one when you join, you get our top 10 investment ideas at the moment. So really right from the beginning, you know what our 10 best ideas in the publicly traded real estate market are. And then going forward on a monthly basis, you'll get a new recommendation, sometimes more than one new recommendation, as well as regular content that we're coming out. We're covering our past recommendations, providing updates on, and talking about the real estate market. So it's really the full package if you're interested in real estate investing.
Perfect. So what do you need to get started?
Really, all you need is a discount brokerage account. So if you're used to buying stocks, and you probably already have that. If you haven't bought stocks in the past, of course, just open a discount brokerage account. These days, you don't even have to pay commissions. It's fantastic. So it really couldn't be easier to get started investing with Real Estate Winners.
Sounds fantastic. So how can people sign up?
Sure, they can head over to real.fool.com. That's real.fool.com.
Great. Thank you so much, Matt. I'm back with Sharon Wilson-Geno of Volunteers of America National Services, and we're talking about senior housing and community. So you mentioned earlier that your communities are going to go through a vaccine protocol. So let's talk a little bit about the post-vaccine world. How fast do you think that things can get back to some semblance of normal in your communities?
I think we're all going to be experiencing one of the buzzwords of 2020, the new normal. Are we going to be able to go back? I think even as a society, are we really going to go back? I don't think so. We're going to take some of the learnings from this and move forward. At what point in time will we be able to open particularly our senior care facilities and make them available for people? I think here in the next 3-4 months, we're going to have an opportunity to do that. I think there's truly pent-up demand in the market. For folks that have not gone into a senior care facility and whose parents have now experienced, difficulty in accessing food, accessing medicine because they needed a higher level of care and were staying at home because they didn't want to be in a more congregate setting. So I think we're going to see a pretty quick blip of those folks going into those kinds of senior care facilities. But then I think there's also the group of people that are going to stay in independent housing type models like we also have on the affordable side, where we'll start maybe in the next 6 months doing more community events in our spaces, being able to bring people together, which is so very important. I think one thing that we have also learned from the first 6 months, we had everybody in lockdown, and we were very, very rigid about that. And as deadly as COVID is, so is social isolation, and so is loneliness. And so we've really had to balance those two things and think through, okay, we should stop talking about everything we can't do and let's start talking about what we can do. How can we engage people in a safe way? How can we do something that's socially distanced where they can see people, maybe through a screen, but they aren't exposing themselves to the virus? So we've really had to double down on balancing those two things. And that will be, I think, some of our new normal, because we're going to continue to serve people that have underlying health conditions and vulnerabilities. So we're going to have to continue to be cautious, but hopefully open things up a little bit more so we can ensure that we're engaging people socially, because it's so important to overall health.
Absolutely. Loneliness, I know, was a problem even before the pandemic for seniors, and it's certainly only gotten worse. I think all of us this year have a greater empathy for what seniors are going through, because we've all been isolated to some extent.
Across the board, when we survey our residents, when we do screenings on mental health, it continues to just above and beyond any other health condition be the condition that most people are so afflicted.
That makes sense. So I want to talk a little bit more about affordable housing. I think you and I both share an interest in this idea of public sector and private sector working together to solve problems. So let's talk about that. And how do you see that kind of playing out in the future?
There are a number of different ways. On the affordable housing side, we've had the low-income housing tax credit since 1986. And while it got up to a slow start, that is a public-private partnership where government subsidy does leverage private investment to build more housing. But it is only as good as, number one, the economic value of private investors for coming into that space, and that goes up and down depending on the economic conditions. So it's not a consistent, reliable source like a federal appropriation, for example, or other kinds of housing subsidy, which you can rely on. It fluctuates, but it is a way that we brought a lot of private money into the affordable housing space during that time. I think the bigger question really lies in the service area. And Medicare and Medicaid are huge parts of our federal budget. And with the growing aging population, they are the drivers of increased that in Social Security, which is also something that supports seniors. Those are the things that are driving our national debt. And if we don't find ways to bring those costs in line, to provide different ways of serving people as cost effectively and really focusing on preventative care for seniors, we are going to continue to dig a national deficit hole that could create a national security issue, because so much of our deficit is supported by foreign lending. And unless we can find a way ourselves to bring those costs down and stop continuing to provide more rigid programs for senior care, we're going to struggle to get that part of our economy under control. And already, though, I think that there has been some changes in that area. Many states with Medicare and Medicaid expansion, with Medicare Advantage, are looking at cost containment programs and managed care programs. Those are all partnered with private sector players, insurance companies, and others who have more of a focus on cost containment. And we're really playing very heavily with a lot of payers right now. Those private sector players see the value in housing. They see the value in what we bring to the table on the senior care side as well. And we're all looking for ways to work together to make those investments in affordable housing so they can help reduce the reliance on payments from Medicare and Medicaid, and thereby reducing the government expenditures in that area.
Interesting. Also wanted to talk a little bit about private companies and that private companies contributing to try to help affordable housing. For example, I know Facebook, Google, a lot of those companies have started putting money toward affordable housing and solving, frankly, some of the problems they helped create in certain cities. But are you seeing a lot of interest from private companies wanting to work with you, wanting to donate or sort of contribute and help solve some of the problems that your company and that your organization is facing?
Yes, and we've had some really good relationships with the private sector banks and investors on the affordable housing side for many years. We have started a fund which will launch in January, a housing and healthcare justice fund, and it really is to help focus private investment around the intersection of housing and healthcare, which is exactly where we're going and exactly where our organization is. We're one of just a handful of national organizations that does both affordable housing and senior care. So we're well positioned to kind of pull these two things together, as I was discussing before. And really being sure we're focusing those investments, particularly in affordable housing, all of which is going to have some healthcare component to it moving forward, in underserved communities, be them racially underserved, underserved because they're in a rural area, or being underserved because of economic disparity. So we're looking at targeting those funds and partnering with the private sector to help deploy those funds in a way that will have some really strong results and can show data-driven solutions to how the intersection of housing and healthcare, particularly for seniors, can reduce costs and provide better quality outcomes.
Is the expiring of eviction moratorium something that impacts your work at all?
It does a little bit, but I'll give you a kind of a hidden one too, which is another area where we're looking for help from the private sector for as well. Most of our portfolio is senior, and most of that senior portfolio, about 75% of it, is subsidized with government subsidies. We're serving folks in that portfolio who make $13,000 a year. They make a Social Security check, sometimes disability, that's about it. So without that government subsidy, and that government subsidy pays the rent, we would be seeing much higher numbers. About 20% of our portfolio is family. And those families are working and relying on wages. Granted, they're getting a subsidy as well. However, that's where we're seeing a little bit of an uptick, not as much as one would expect, because they are the lucky ones. They are the 1 in 4 families who need housing subsidy in this country that actually get it. It's the other 3 out of 4 that are living in unsubsidized housing, that are in the private market. Those are the ones that are probably most vulnerable. But I'll give you another hidden one that affects us more than people would think, and it is really an issue that we're working to solve here. It's our healthcare workforce. The people that are caring for seniors are low-wage workers. Many of them work in our dietary, our laundry. They're certified nursing assistants. They're LPNs. Many of them work 2 jobs to make ends meet, and struggle. Many of them now with children, trying to struggle with virtual school, and because we've had illnesses and people out, we've been short-staffed. So, like all other skilled nursing and other senior care spaces, so we've been relying on them to pick up extra shifts. Those are the folks that I am really most worried about from the eviction moratorium standpoint. And if they've gotten COVID and had to be out of work for a period of time, we've been doing our best to cover and help them. But really working with healthcare systems and others, we have a couple initiatives going on right now that are very nascent to develop workforce housing for healthcare workers. It's a really growing need, and unfortunately, because of the way Medicare and Medicaid works, the wage scales for those workers have not been able to keep pace with the rising cost of living, and particularly the cost of housing in certain communities. So that's a problem we're really looking for private partnership to solve.
Yeah, that's a huge problem. Workforce housing is, I think, one of the most important issues that we're facing right now, because there simply isn't enough of it, and we've seen real estate prices rise, rent rising all over the country, and it's just not it's rising faster than wages in many cases.
Exactly, and that's not. We've had a little bit of economic downturn during COVID. Rents have not been dropping, at least not residential rents at this stage of the game. So that issue just persists.
So in terms of building communities, are you building them out? Are you doing any adaptive reuse or anything like that?
A couple things that we're involved in. One is we recapitalize our own senior portfolio as it ages. And, some of it was built in the 70s and 80s and needs to be recapitalized. We are coming in and recapitalizing those. We're doing a big recapitalization project in Miami right now. Those buildings were built in the 80s. They need updates to serve the more frail population that we're serving today. When we built those buildings, those people were in their 50s and 60s and relatively able-bodied and stayed there until they went to a nursing home for the last 10 years. We now have people in those buildings that are living to be 100 plus. So we have to be sure that they have grab bars, lighted hallways. We're doing the technology upgrades to allow for the opportunity for home and community-based services to come in and transmit medical data to make that work, doing the social isolation pieces, and adding, where appropriate, healthcare space, where we could have clinical space in those buildings, where we could have opportunities for social workers or other groups to come in and do a little clinic on blood pressure, or do commercial kitchens where appropriate, where we could provide a meal service if necessary. So we're doing a lot of recapitalization on one hand. On the other hand, all of our new builds are all being built with an eye toward integrating housing and health. So that's a big focus of what we're doing right now. We're doing no senior buildings right now that don't have some healthcare intersection depending on what the community needs. So all those buildings moving forward in terms of our new construction will be that. We're also looking at, we're starting increasingly to do more and more acquisition of buildings that would otherwise be lost to the affordable housing space when their different requirements expire. Investors can take those to the private market in some circumstances. We've been stepping in and trying to acquire some of those properties and preserve them for affordable, reposition them, because most of them are at least 15, 20 years old, and again, with a healthcare component to them.
That's interesting. I talked to someone who develops modular healthcare, and he was saying that large hospitals are going to become less popular, and that we're going to see more small hospitals and more medical that's more spread out and accessible to people. So it sounds like that's part of that trend as well.
It is. We're actually doing a really interesting project right now with modular with veterans. So it's a targeted program, many of whom are also senior or folks with physical or mental disabilities. That'll be not a congregate building, but will be small kind of bungalow style units that could be could be an accessory dwelling unit in somebody's backyard or an extra lot, where cities are really seeing this as an opportunity to utilize to put more affordable housing in cities that are increasingly becoming overbuilt with high-rise housing. So that's one interesting thing that we're working on right now. And that's also, there's demand for that in the senior space as well. Again, getting back to the earlier conversation, there's a feel among seniors of this generation that they like that idea of having that front porch and being in a community where they could be supported, but maybe not in a high rise or other kinds of congregate setting. So there's some of that going on in the senior space as well.
Interesting. I've seen a couple stories about hotels that are being converted into senior living. I know that I'm watching the hotel statistics right now, and we're going to see some hotel foreclosures. It's going to be a rough year for hotels. Do you think that's another aspect that's going to become more interesting next year?
We actually just are working with the city of Los Angeles on an opportunity in Los Angeles, actually, for 2 hotels. The thing that I think we have not even begun to scratch the surface on, but is coming to an office building near you, is adaptive reuse of office space. As we are all going to sort out here in the next year, who's going to go virtual, who's not, how permanent that is, and a lot of organizations looking to really shrink their footprint. I think we're going to be looking at opportunities to do interesting adaptive reuse of office. And I'm excited about that. There hasn't been a ton of that done. And obviously there's some structural things that make that somewhat more challenging. But I think in certain cities where it's been very difficult to get real estate at a cost that's effective for senior housing, this might be a real opportunity to bring people into communities and make them feel more relevant, rather than communities that are on the outskirts of town with pretty lakes and greenery around them, but sometimes can be isolating for certain seniors.
Yeah, I think that's really interesting too, and that's something that I'm excited about. So let's close up on a positive note. What are you most optimistic about next year and in the next 5 years as the need for senior housing continues to grow?
I got to tell you, I am really excited about what I feel like is happening. First of all, just the focus on seniors. I mean, the fact that this has been sort of a quiet population that people have taken for granted, now folks are really targeted, are understanding better the demographics of the senior population, the growing population, and the needs of that population. So just focus around that, I think, is a really important piece. The second one is the focus on our healthcare workers. First responders, essential workers, heroes. So we're finally recognizing the contributions that these people make every single day. We have started here, but they have been sadly underpaid by the systems that have allowed that to happen. We've made a commitment here to begin to bring all of our workers up to a living wage in all of our geographies across the country. It's going to take a commitment on our part over multiple years to make that happen, simply because the revenue streams from Medicare, Medicaid, and other programs don't support it. But we're making a commitment to do that regardless. So that, I think, is a really important issue, and that we need to value those people for the services they provide and how important that is. And the final one is really this focus on technology and what role will technology play in serving seniors moving forward. One of the initiatives we have right now is just to get all of our buildings wired in a way where people can use personal devices. Many of them were built, a number of years ago where that really wasn't necessary. But we're going back and doing that now, and not just we have a couple demonstrations going on where we're using Alexa and Google Dot in certain buildings for social isolation purposes and communication purposes, and those are going well, but really being sure that they are wired sufficiently to allow healthcare workers and home health aides to come in and out and transmit medical information from the home. There are all sorts of assistive devices right now that can measure your heart rate, your blood pressure, your blood sugar. I saw one that was generated by radar that didn't even need Wi-Fi, that I thought was pretty cool. So there's all sorts of noise going around this technology space. And I think as we've come to recognize that the cost and just the workforce to support seniors one-on-one is not going to be there in the future, given the growth in the population, we're going to have to shift, particularly for low-income seniors, frankly, we're going to have to shift to more cost-effective ways that are going to be driven in part by technology. So that's a really exciting part of what's going on. There's a lot of noise going on.
Yeah, I think telemedicine has proven this year that it's actually very viable and very useful.
And it's really taking all these different devices and technology things and figuring out exactly where they fit. Telemedicine is a tool in the toolbox, but I think we've also learned over COVID it's not a panacea. So it has a role, but where does that role fit, and where could other technologies play a role, and where do actual humans have to come in? And so we're all kind of learning what that continuum is. And the other thing that's exciting about it too is that even before COVID, to their enormous credit, the Centers for Medicare and Medicaid have been looking at ways to use the Medicare and Medicaid payments to start paying for these kinds of alternative preventative devices and other things, including broadband, including preventive health, including exercise opportunities, including all these other things, because they're recognizing that if they don't pay for those kinds of things up front, the cost when someone with a chronic illness goes to the emergency room is significantly higher. So the flexibility that they're now showing under their waiver programs to support a number of different solutions and create a very large smorgasbord from which different populations and different individuals can select at different parts of their life too, because it's not static. You might be looking at certain kinds of interventions at one point in your life, another kind of intervention later, and you might go back to the other intervention because something else has happened. So just creating all those different opportunities and figuring out how those pieces fit for each individual is really going to be our future, I think.
That makes a lot of sense. Well, Sharon, thank you for your time today. And just a reminder for our listeners, you can find out more about Volunteers of America at VOA.org. And we named VOA one of our top places to donate this year on Millionacres because they serve a growing need. So I hope you will check them out. Thank you for tuning in to the Millionacres podcast. I hope you liked today's show. If you enjoyed this episode, please consider subscribing through your favorite podcast provider. And if you have any questions, please feel free to drop us a line at help@millionacres.com. Stay well and stay invested. People on this program may have an interest in the deals, offerings, or services they discuss, and Millionacres or The Motley Fool may have a formal recommendation for or against. Always consult a certified tax professional before acting on tax advice, and do not buy or sell assets based solely on what you hear.